How difficult is it for people to keep that health? If they have the surgery and they lose the weight and their blood pressure gets better and their type 2 diabetes get better, they have obstructive sleep, how do they keep that weight off after a year or during that first year? How often do they have to come back? What kind of vitamin replacement do they need? Talk to me about follow-up.
So weight regain is probably the patient's greatest fear. And unfortunately, there is some incidence of weight regain with every surgery, including the sleeve gastrectomy. Probably 25 to 30% of the patients who have a sleeve gastrectomy may regain some significant weight. I tell my patients, I think the trick is to stick with the plan. Our plan is to have 3 healthy meals a day, high protein, low carb, low fat meals, and regular activity.
So when you're saying 3 meals a day, how big is the stomach with a gastric sleeve? How much can you put in the stomach? It seems to me like 3 meals would have to be small, but apparently the stomach will stretch.
The stomach does stretch some. We'd like it to end up holding about 5 or 6 ounces, about the size of a large banana, as we mentioned. But they can eat enough healthy food at lunch to make it to dinner without being famished and needing to snack. The idea is we're trying to get away from high carb meals. We're trying to get away from snacking, which is just a bad habit. We don't really need to do that, right? They'll be able to eat enough healthy food at breakfast to make it to lunch, at lunch to make it to dinner.
So do people come back for counseling? Do you have a counseling group? If somebody has the gastric sleeve, they start to lose weight, and they feel so proud of themselves, do you have them come back regular to weigh to keep them on track?
Absolutely. They'll come back and meet with the exercise physiologist. They'll meet with the dietitians. They'll meet with psychologists when appropriate.
So you have an exercise physiologist that helps them out?
Master's level, yes.
Master's level. So that's, what is he able to do with them? Talk with each one and find out what their problems are, how to get them to...
Sure, and we all have physical limitations. So the physiologist will find out what those are, find out what the patient has access to in the terms of equipment or whatnot, what they like to do, and collaboratively together sort of make a plan for their activities.
So how often do they see the physiologist, the exercise physiologist? They see him once every 3 months, once a month?
Probably start seeing him about 4 months after surgery and see him a couple times during that first year, 2 or 3 times during the first year.
How about nutrition guidance? You know, you try and get them high protein, low carbohydrate, 3 meals a day. Who guides them to that?
That's the dietitian's role. And periodically, we will check their nutritional parameters, blood work. And if we find deficiencies, which are common both before and after surgery, then the dietitians help instruct the patient on how to correct those nutritional deficiencies.
Are there certain things you look for, certain types of minerals, certain types of things that are not absorbed, like calcium, like selenium, copper, magnesium, some of the things that are really, really highfalutin as far as nutrition goes?
Sure, absolutely. We monitor for all of those things. Common ones that we have problems with would be iron, for example. Magnesium deficiencies are very common, even before surgery.
So how do you replace it? With vitamins? How do you know how to take it? You've got a new stomach in there. Where is it absorbed? From that new stomach or from the small bowel?
Well, all of our nutrition pretty much is absorbed in the small bowel. We're fortunate now to have guidelines, what we call clinical practice guidelines from our medical societies on what vitamins and mineral supplements patients should take after sleeve gastrectomy, for example. Now that little formula is not going to be perfect for every person, so we still have to check the blood work periodically and adjust that formula to make it a custom just for that patient, if you will.